A very good morning to you. Welcome back to Jersey Tech Week. I can't believe it's day 3 already. We are halfway through our 5-day jaunt around the island and indeed the world's digital industries, working through theme by theme. And today I have quite a serious question for you. How are you? No, really, how are you this morning? Are you in rude health? My reason for asking is because today we are focusing on all things digital health. Let me just take you through what we've got in store over the course of the next 2 hours. In just a minute, we're going to be speaking to 2 leading luminaries of digital health in the island. That's Andrew Mitchell and Austin Gibb. We'll also be speaking to Dr. Keith Grimes from Babylon Health to talk about how to focus on the world of digital, but maintaining a human touch as well. We'll be referencing the immersive arts in health a little bit later this morning as well, and talking about women in health. We'll be looking at Jersey's sandbox and how digital health can plumb into that. And then we'll be bringing together all the themes and the thoughts of the morning with a panel discussion a little bit later on this morning. So lots to come during the course of the day. However you're watching us, share your thoughts and comments using the hashtag Jersey Tech Week. That's on all social media channels. But right now, let's begin with our first session of the morning. We are going truly interactive. Let's hand over to Andrew and Austin. Gentlemen, good morning.
Good morning.
Good morning, Gary. So my name's Andrew Mitchell. I'm consultant cardiologist here in Jersey and also Chief Clinical Information Officer. So we all know it's been a really, really challenging time in healthcare, but it's also a really exciting time to be involved. And the new digital health technologies we have available are going to transform the way that we can manage and deliver healthcare in the future. And Jersey is perfectly placed to do that. So with our infrastructure, our high-speed network, our integrated GP and consultant network, a committed government, and we've got a new plan. We've got a plan to deliver some really exciting new healthcare technologies over the next couple of years as we build up towards the new hospital. So what I'd like to do is hand over to Dr. Austin Gibbs, who's going to talk you through some of those things.
Oh, good morning, and I'd like to extend a warm thank you to all those speakers who agreed to come today and all the hard work that's gone into making this a great success. Keeping on VR, I'm going to do my talk in VR. Well, good morning, ladies and gentlemen, and welcome to the moon. I represented a particular challenge when we went to get 100% fibre to every household in Jersey, but they were successful, so fair play. And also remoting in really, really works for me. That commute was getting a little onerous, to say the least. Now, my name's Dr. Austin Gibbs. I am director of the Allan Lab on the beautiful island of Jersey. We are a digital health research laboratory, and we're part of the HealthX working group of a variety of government departments coming together with Digital Jersey to try and deliver digital health. And we're here on the moon because, well, it's kind of cool, but we want to shoot for the moon. We want to create a patient-centric exemplar of what can be achieved leveraging digital technologies in the health space. And we're also here because the Apollo program itself has a lot of similarities with what we're trying to do to achieve that. For them, failure meant a risk to life. Thousands of moving parts and people through both government and private industry, hugely ambitious and driving into the unknown. So we can learn a lot from that because, well, they were successful. The biggest thing was their clear mission statement. They had a clear strategic goal, landing a man on the moon and returning him safely to the Earth. And every decision, every action everything they did had to tick that box, had to drive down that path towards that destination. So for us in Jersey, our mission statement, quite simple. Right data to the right person at the right time. That's it. The right data. Fundamentally, health is making decisions based on data. The right data means the right decision and the right outcome. This encompasses data quality and acquisition, consistency and analysis. You see, errors in health get multiplied as they go through the system, and avoidable mistakes get made. The right person. Every piece of data has a home, a place it's required. Getting the right person has impacts upon user interface, work processes, patient involvement, cascading, governance, and audit. The data in the hands of the person it was meant for, without stumbling into that terrible data fatigue. The right time. Health data has a time value to it, ensuring you get just-in-time interventions, prioritization of resources and deployment, guidelines, clinical decision support, infrastructure and integration optimization to remove lag and delay and remove noise and treacle. You see, we're actually all patients and all carers. Put the patient at the center of everything you do, and with the right data to the right person at the right time, you get a great outcome. But unlike Apollo, we aren't starting with a blank slate. We can't just flick a switch and fire off a rocket. In Jersey, we have 307 different health applications, all in different ecosystems with different levels of integration. Years of underfunded IT and poorly implemented IT has left us with this environment. So we have to lean on Darwin. We have to evolve our ecosystem. And we use the selection pressure of right data, right person, right time, patient-centered to go through that. But evolution means failure. We will inevitably have some things go extinct. Some things we will make extinct. And some things we'll milk. We have to embrace that failure. You see, the Apollo program had failure. On January the 27th, 1967, Apollo 1 was undergoing a launch rehearsal test at Cape Canaveral. At that time, the capsule was pressurized with 100% O2, and faulty wiring led to a catastrophic failure. The door was so complex it was impossible to remove quickly, and 3 astronauts lost their lives. The Apollo program was very nearly cancelled. NASA embraced that failure. There were obvious design flaws, but in their brutal, honest analysis, one of the root causes of those design flaws was a lack of disseminated information from those at the very front line to those making decisions further up the chain. They rectified this, and the Apollo program went on to be hugely successful. And the subsequent space shuttle program, until Columbia. And in the investigation into Columbia, found that they'd slipped back to their pre-Apollo 1 days, and the same mistakes had happened. Sound familiar to anyone in health? You see, for us, we have to embrace failure. We have to learn those lessons. At the moment, the fear of failure is so great that in trying to avoid all failure, all risk, we end up on this meandering path away from the destination we want. We can't see the wood for the trees. Now, obviously, there's risk mitigation, but there needs to be a balance so that the process itself doesn't become the very risk you're trying to avoid. The terror of error doesn't cripple the progression. You need to be able to walk freely along the path. And what is that destination? Quite simply, right data to the right person at the right time. Shoot for the moon. Thank you for your time. Feel free to exit and climb back aboard the rocket. It'll only be a 3-day trip back.
Austin, you can take those goggles off now. I have to say, when we put you inside a virtual reality world, you sped up with incredible enthusiasm, but we heard what you said there. So much interesting stuff in this immersive world we just went inside, but this is your life.
Yeah, I absolutely adore VR. It's got a great role to play in health, lots of interesting things we can do, and it's good fun. We will post that at a little slower speed. It played a little bit fast. It sounded like I had 15 espressos this morning.
Well, I'm glad to hear that, because it was interesting to watch and listen to the first time, but actually there was so much in there to unpick. I think we'll all appreciate looking at that again, and I'll make sure on the Digital Jersey accounts we share that later in the day as well. Let's just start with you. This world of VR, where did this begin for you? Because this is not the obvious career move for anybody. This is pretty niche territory, certainly at the outset.
I think if you're a dyed-in-the-wall nerd and you cut me, I'll believe binary, you always seek out these kind of new and interesting technologies. But on a serious note, when I first encountered VR, the big thing for me was I knew it wasn't real, but it felt real. And that has a lot of potential power that we can use in health. I mean, ultimately, a lot of what we do to patients is fairly unpleasant, sticking needles and such like. And who wouldn't want to be sitting on the beach in Beauport listening to some lovely terns flying across the ocean when you're having a needle stuck in? So at the very least, I was looking to give patients an opportunity to just have a slightly better experience of health.
And that's really interesting, isn't it? We can focus so much on the technology in play here, but ultimately this is about improving not just outcomes, but patient experiences. I think of my own experience in recent months. I've been like a pincushion at times, and I have a terrible needle phobia. I have to take diazepam. I have Emla cream put on the back of my left hand.
I'll reach for my headset now, shall I?
Do you know, this is my point. It is literally the only part of my body they can get a needle into is the back of my left hand, and that's a huge achievement. But you're telling me if I put a VR headset on, you could trick my brain and take me on holiday somewhere and get me through this? Because if so, sign me up today.
The truth is that the brain that we have sort of two elements. We've got our old sort of ancient lizard brain, and then we've got this rather wonderful cerebral philosophical bit over the top. But quite a lot of the time when a needle's being stuck in, it's your lizard brain that's doing the running. And the VR is good enough to trick that like an optical illusion. So you can get quite a relaxing, pleasant experience. It's not perfect. We wish we didn't have to stick the needles in the first place, but at least it can make it slightly nicer.
Well, and slightly nicer, I think, is actually a huge leap forward. Let's talk more about that in a few minutes' time. Andrew, let me just bring you in here. Where do you come into the equation? Because every time I hear you in the news, in the business media as well, you are so plumbed into digital health in this island, and it really feels like you're the man leading the charge.
Yeah, so I got appointed as the Chief Clinical Information Officer for Jersey and started in September last year. So I picked up on the digital health strategy, which was done by Digital Jersey and the government, published in 2017. And I set out a delivery plan of how we're going to achieve that, which, as we said before, is challenging times at the moment, but we do need to implement these things and invest in these new technologies. So I'm passionate about Jersey. I was brought up over here. I want to make Jersey one of the greatest digital health environments in the world. And there's no reason why we can't do that, because we've got the fibre, we've got the people, we've got the government, And there is money out there, and it doesn't cost a lot to do it.
And that's the thing. It strikes me all the ingredients are in place, and one significant new ingredient that is finally on the horizon, the prospect of a new hospital. And this is not just a hospital we're building any old time. This is a hospital we're now building right in the middle of a digital transformation age. So that strikes me as only huge opportunity.
Absolutely, and digital runs right through the middle of that whole hospital implementation. So one of the jobs I've got is to design the sort of the brain and the heart and the nerve system of that new hospital, which might be 1/7 of that whole hospital build. Because if we use the right technology, we can actually reduce the need to move notes around, move all those bits of paper around. We can improve the communication interoperability and give people the right data at the right time in the right place.
Now that's a really important point, and it's been a recurring theme during the course of this week is the individual, the citizen, and their data. Now we take that to a whole new level when we get into the world of digital health, because actually my data is my data, but it's incredibly sensitive data, and there are sensitivities around that.
Yeah, absolutely. And historically, if you went to go and see your GP, he'd sit behind a screen like this and he would be typing away and you wouldn't actually see what he's seeing. Yeah. And then you'd have to put an access request in to see your information. But we've got a 180-degree spin on that now. So we believe that the person or the patient should be in control of their health records. And you might choose to share it with Austin, or you might choose to share it with me as your cardiologist. You might choose to share it with the hospital and your GP. You'd probably be foolish not to. But if we can achieve this, we can give the patient all of their medical information. And as they move around within the island of Jersey or the hospital of Jersey, you take your information with you. So you can deliver healthcare anywhere within the island without having to be in a great big building.
And it strikes me that there are so many positives to come of that, not just the lag of chasing paper records down trolleys and corridors and basements and then from building to building, and the left hand not knowing what the right hand is doing. If I choose to give you my data, Austin, and there you are in VR world, but we're talking in real life right now, what is it that you could do with it that would improve my outcomes?
Now, the thing is, we're all patients and we're all carers. I think there's always been a sort of division between, the professionals will hold the data. It's very much like back in the day with your kind of vicar or priest. I have the Bible in Latin. I can see it. Only I can see it. That needs to change. We need to get our King James Bible out there. We need to make sure that you've got your data, I've got my data, and we're sharing it together. If we have a connected healthcare system, we can make predictions and we can see things. We can shut the gate before the horse has bolted, rather than sort of always managing the fires, managing the problems as they appear. The future of healthcare is data. The future of the entire of this technological tech week, everything will be about data. If we can get the right data to the right person at the right time, regardless of whether we're in health, fintech or anything else, you can have the right decisions and the right outcomes.
And it strikes me as Jersey is beginning to roll out what's called the Jersey Care Model. And for people watching us overseas, this is very much about delivering as much healthcare in the community as possible, and also a real refocus and re-emphasis on preventative healthcare. Quite frankly, fewer people needing a hospital bed, and if they do need to go to hospital, in and out quicker than they ordinarily would be. I'm guessing you're going to tell me, of course you're going to tell me, by having this data, by being able to crunch trends within this data, you can play a big part in that.
Yeah, I mean, if you think about the way that policy is written and the way that healthcare is written generally for an island strategically, those decisions are taken on. We try and sort of guess the best. Handing over a huge connected set of data, a digital twin, you could try out those policies. You could say, well, what if we were to make all the buses electric? What would happen on childhood asthma rates? What would be the admission to hospital of COPDs? Would that impact and that cost offset the cost of putting electric buses in? If we can say it does and we model correctly, great, we can look at that. Those kind of policies, and it allows people to kind of flex themselves a bit and try some kind of radical ideas in an environment where it's safe and we can test and see if it works.
I find that a mind-blowing concept, that you are not just living in the world of health, but by having this digital twin, overlaying your health data with wider infrastructure data, you can model these outcomes at such a level of granularity?
We're very fortunate here in Jersey. The advantage we have is that we are an island. We do have a natural border and a captive population, but we also have things like single suppliers, which make those modelling easier. We've got great infrastructure, the fibre here, the IoT, the rollout of 5G and things like that make it really, really doable and feasible.
Andrew, in fact, I said I'd call you Andy. We're staying informal today, aren't we?
Yeah, that's fine.
You're inside the room now. You're inside there in government as they're designing all of this. Do you think there is the will to make this happen? Because I imagine for some people, there'll be a lot of baggage of fear that comes with all of this because of the newness of it.
Yeah, so I mean, if you look at the number of health applications we've got 307. Well, we did have 307 health applications, and one of the good things we're going to achieve by this is to actually simplify a lot of the way that we deliver care. So we're not going to be bringing in a lot more new things. We're actually going to be paring it down and having a higher quality of data information sharing. So I'm not sure there's much fear about out there. I think there's a lot of excitement.
There's certainly a lot of excitement, which brings me on to, in Jersey, in just the past week, the launch of Jersey COVID Alert. Look at the smiles on your faces as soon as I mention this. We have an app that is for people watching elsewhere, similar in style to what we've seen rolled out, for example, with NHS Scotland. And already, in fact, today is a week today, 10 o'clock this morning is a week since the launch. I think we're at something like 33,000 downloads in a population of 108,000. I cannot think there's anywhere better on the planet as far as that uptake goes. Just tell me about your involvement in this.
Yeah, I mean, originally my digital fellow who works in the Allan lab, who's a fantastic fellow, but slightly difficult to manage because once he gets the bit between his teeth, that's it. You ain't going to turn his. And he came to me back in sort of January, February time saying, we really need to do this. This is really important. On an island such as Jersey, this technology is particularly powerful. If we can get a decent uptake, it means that we can continue to live our lives without all the pressures of lockdown. And it gives another tool to Ivan Muscat to keep us going. You know, it's very easy to say, oh, well, just lock everyone down, shut everyone away. But the economic impact of that has an impact on health, on mental health. So it's not quite that simple. He came to me, he'd been reading all these papers, he'd written some white papers. And at that point, I was like, OK, I'm just going to let you go and do this. So I'm going to sort of second you to this, and sat next to the office next door, listened to multiple conference calls and general sort of swearing and thrashing around because it was an extremely complex problem. And then with the involvement of Tony Moretta and Rachel together, that thing then sort of snowballed, and I'm really, really happy for them that they've got it over the line. But I'm particularly happy that the population of Jersey has seen what we're trying to say. We're not tracking you. We're not taking your data. It is anonymous. It isn't what you think it is. It isn't this track thing. There isn't any policeman going to look at your phone and find out who you've been talking to and where you've been. I can assure that because we developed in my lab, and to be fair, Max is very much of the digital hippie, I guess, when it comes to privacy of data. So I know for sure from the ground up, he's made sure that that's the case. And people have taken it on board. And if we get to sort of 50, 60%, the science says that we can almost run eradication here in Jersey, which is a fantastic thing. And then supported by the book and trace system, the testing that we've got some of the best ways of dealing with this in the world. People are looking to us and going, I wish I had those bits and pieces to help me fight. And we've got them, and it's fantastic.
Yeah, Jersey's nodding away all the way through this. It's difficult to overestimate what an incredible additional tool in the armory this is.
Yeah, and we are in a really, really lucky position, but it's more than luck. It's down to the work of the government and organisations like the Allan Lab and Digital Jersey and modernisation in digital, and everyone who's come together to deliver all of these tools to protect us. And I think we are in a strong position locally here in Jersey. I would encourage anyone who hasn't looked at the app to download it. 33,000 is amazing, and it's probably one of the highest per capita in the world, but we'd like to get to 50. As Austin says, it's safe, it's anonymous, there's no downside. So if you haven't looked at it, I think people should.
Well, I'm certainly not one to endorse a product, but actually I'm very happy to, because all those concerns you mentioned Is Big Brother watching? Are they taking your data? Actually, just scratch beneath the surface of this and you realise it is nothing like that at all. And actually, it's a good example of where you're in control of your own data on your own smartphone. And it's up to you whether you're sharing that with the contact tracers and indeed whether you want to flag up to other people if it's time to do so. Listen, we've only got a couple more minutes. I could chat to you all day, as is the nature of these things. We need to move on eventually. What's the next big thing for both of you? What happens next that I don't know about that will make my jaw hit the floor?
So through the course of COVID, we set up a new organisation called HealthX, or Health Extended, and it's an inclusive organisation involving everyone involved in digital health. And one of the early outputs of that is we're going to change the core operating system of the hospital. So that's an electronic patient record system. It's costly, but it's absolutely essential. And it gives us the agility to then take us forward to the new hospital. And we're planning to get that signed off in March.
So effectively, an operating system that everything hangs off.
Yes, within the acute hospital, absolutely.
Wow.
What
about yourself,
exciting.
Austin?
Yeah, I think HealthX is a really important point. I think in my talk, hopefully the slowed down version, it will be a little clearer. But in my talk, I talk about the need to move beyond the terror of error to really sort of the digital technology. We need to move quickly and we need to get these things in place because the current system is very broken and we need to use these technologies to fix it. The key way of that and the key thing we've seen in COVID is the collaboration between government, private, lots of different departments all talking together. We meet once a week. We've got representation from all the various aspects. We've all got visibility. We all work together. If you just look through things like some of the submissions to the OneGov awards, the stories in there are, goosebumpy. Hundreds of people all across government passionately working to make it better and working together. We can take that and move that forward and have a fantastic government and system here in Jersey.
Listen, the pair of you, I feel utterly energised and enthused from my own health experience of the past 12 months in the island and in the UK to think where we're already at and where we're going to get to with you two on the front line is very reassuring. Thank you so much today. And if you did want to see that presentation once more, go inside the VR goggles with Austin a little bit later. We will post that on social media. The pair of you, thank you so much. That is just the start of our Digital Health Day. It is just the start of the story. We've spoken a lot there this morning about how technology can help patients, but it's also important to talk about how we can ensure the humanity is kept in place when we talk about digital health as well. Right, it's time for my first virtual link up of the morning. Dr. Keith Grimes, are you there? Keith,
yes, I am here.
A very good morning
Hello.
to you from Babylon Health. I'm really looking forward to this. It's straight over to you.
Thank you very much. Well, thank you everyone for this kind invitation to take part in this presentation today and this talk today. I'm really sorry that I can't be with you in Jersey. It's more of a problem on our end, clearly not on your end, as things start to get locked down here in the UK. So I hope to be able to come across to you soon. But this morning, I'm just going to start by taking us through a simple question, or hopefully I think it's simple. How can digital technology help bring back the humanity in medicine? So, I think if we're going to ask this question, we first have to answer a very simple question. What makes medicine human? Now, this one question could take the entire morning, so I'm going to boil it down a little bit, and let's look at maybe a simplified version of what is it about medicine that makes it human? Where's the humanity in medicine? And I think this picture is a really useful way of summing up what people believe humanity in medicine looks like. It's by Sir Luke Files, who is a Victorian painter in the social realist tradition. And this is arguably his most famous painting. It's called The Doctor. He painted it back in the late 19th century. And in this painting, you can see a scene depicted in a cottage. And on the left, we have a doctor carefully attending to a sick child, with the parents distant and unable to help in the background. It's clearly a poor person's cottage. You can see the mismatching chairs, a makeshift bed, and the child lying there under the watchful gaze of the doctor. And the doctor's watching for the crisis, the moment at which the fever breaks and the child starts to recover. On the left of the doctor, you can see a lamp, and that lamp is a symbol of the fact the doctor's been there all night watching for this moment, ready to take action. But on the right, you can see the rising sun, the light of the dawn coming through, and this signifies hope. And this picture was incredibly popular, went on show back in 1890s and actually toured the country. And it's been used countless times in media. It's even appeared in an American stamp to help symbolize what the idealized relationship between a doctor and a patient is. And within this, we see three of the key features of human care. First, personal knowledge, not just a personal knowledge held by the doctor of their science and their art and the craft of medicine, but also maybe of the family. Continuity, the continuity of knowing a little bit about that family, but also the continuous attention to care here, having been there all night. And crucially, time to care. Space to be able to deliver that really most human interaction as well, to be compassionate, to be empathetic. So clearly people really love this and really register with this. But if you look a little bit closer, there's a little bit more to this story. What's missing? Well, what's missing from this picture is technology. Now, I'm not, of course, talking about smartphones. This is back in the 19th century. But the doctor's not got a stethoscope. The doctor's not got a sphygmomanometer. These are things that were commonly used by doctors at that time. So this critics and analysts have sort of looked at this and said, well, actually, maybe this is a rejection of technology in medicine and harking back to a simpler time. Now, this picture was also informed by the death of Sir Luke Files's son on Christmas Day at home, when a doctor did come into attendance as well. So a simpler time. But also it depicts something that almost never happened, which was a doctor doing a home visit to a poor person's house. So even at that time, even as this painting was put in place, it was people were wanting something of the humanity back, but pressures on the doctors at the time prevented that. So where did the humanity go? Why did the humanity go anywhere? Well, it comes down to something really quite simple: demand and supply. So let's have a look at the world. This is planet Earth, and currently we've got about 7.7 billion people. And in 3 years' time, 4 years' time, we're going to have about over 8 billion people on Earth. But the demand for healthcare is absolutely enormous. I mean, it's best exemplified by this statistic, which is that Google serves over 1 billion healthcare queries every single day. And that is growing too. So you've got a huge demand. So what about the supply? Well, currently in the world, we are about 5 million healthcare professionals short. And by 2030, that's forecast to rise to 18 million healthcare professionals around the world short to provide and meet the need of a growing and aging population. In the United Kingdom as a whole, it's 100,000 short just now, rising to nearly 250,000 by 2032. So we're clearly facing an enormous amount of pressure, which squashes down on that time to care, and doctors increasingly have to do things almost like on a production line fashion. And then, of course, you have COVID. I checked this on Sunday, and I'm sure this has gone up a huge amount since. 40 million global cases so far, over 1 million deaths. This is stopping us physically seeing patients. This is causing us in some places to have to pause traditional care. So the pressure is on. Humanity is being squeezed out. So how do we bring humanity back? How do we bring back that personal knowledge? How do we bring back that continuity? And how do we bring back the time to care? Babylon believes it's possible to put an accessible and affordable health service in the hands of every person on Earth. And we think that the only way to do this would actually be to use digital health. Now, this is a morning discussing digital health quite broadly. We've got some fantastic speakers a little later on to look at the edges of this and other different perspectives. But simply put, it's the convergence of digital technologies for health, living, and society to improve the efficiency of healthcare delivery and make medicine more personalized, personal knowledge, and more precise. So that's exactly what we are doing to deliver on our mission. And we've created a digital-first, end-to-end health service delivery model that aims to become the continual point of contact throughout the entire health life cycle. And we do this by putting in, broadly speaking, 3 layers. The first layer is AI and digital health-driven health services within your phone. The next layer is virtual health services, telemedicine, remote messaging, and the like. And then finally, because of course you do still have to see patients, augmented physical health services. And by blending these 3, we think we stand the very best chance of being able to deliver healthcare. Now, technology can link healthcare together and make it better for absolutely everyone. And we start by putting the patient right in the very center. So here in the slide you can see right now is the heart representing the person. And we have two areas, or we conceive of healthcare at Babylon in sort of two sections. We have sick care and healthcare. So let's start on the bottom right here. Person presents with a symptom. With those symptoms, they come to our app and they use the symptom checker to help better understand what their symptoms might be. They're empowered to care for themselves. You can help identify what the condition might be and not only give them information on the potential causes of those symptoms, but also what to do next. Right, next up we have treatment. So this is giving advice and guidance on the best possible treatment. Next click, thanks. And then we have rehabilitation. This is about not only getting a person back to their pre-morbid state, but returning them to potentially a chronic disease state. Next click, please. And then we have the ability to deliver chronic disease management. But we also want to address healthcare too. So if you click on one more time, and within our app, we have a comprehensive health assessment, and that's done through a product called Health Check, where people can answer questions about their risk factors and identify their risk of disease going forward. Next one, please. We can then help them plan, put together a care plan or a plan of action. Sorry, I'm being asked to see if I can get this up and running again. A plan of action to get them back in. I'm afraid I can't access any of the controls through the link. Can we have the next link, please? Then coaching, taking them on to the helping support them to actually achieve these actions and achieve a better state of health. Next click, please. Monitor is actually being able to not only monitor their progress against this, but also track some of their body measures too. And then finally, as we collect all this data, we then be able to get some information to help patients understand more about their current state of health and help predict when they might deteriorate. But that also works for the clinicians caring for the patient and also for larger populations. And as you can see with this diagram, this central circle is provided by technology. This does much of the heavy lifting, freeing up doctors and nurses and healthcare professionals. If you can click. If you can click for the next link, show virtual services, and again, one more click, the physical services. Next click, thanks. Technology deserting me at a time when I have the densest number of clicks to go through. It gets a bit easier from here. Anyway, so that is how we structure the journey of care and all the different intersection points to help offload doctors to help them have more time to care. So how is Babylon different? Well, at Babylon, one of the nice things is that we get to have all of the components of this journey under one roof to help integrate this. And we achieve this integration through something that we call the AI brain. Let me just see if I can get the controller back. There we go. Fingers crossed, everyone. Oh, celebration. Okay, right. Now we're on to the next one here. So with the Babylon brain is one way of conceptualizing how we use all these different digital health tools and bring them together to deliver these services. So it starts with the foundation, and that foundation is the knowledge base. This is our custom-made machine-readable encyclopedia, which is a registered extension of SNOMED. It's curated by clinicians, and we use a custom user interface called the Knowledge Portal to help build up this dictionary of terms. And this is used to define all the data that's generated by the digital health tools that we have within Babylon. And I'm very pleased to say that we're also part of HL7 FHIR community, which means that not only do we share the data internally to allow us to provide this integrated care, but allow us to share it externally as well. And I'm really pleased to hear about the work that you're doing in Jersey on the new electronic health record in your hospitals too. I'm sure they will also be HL7 FHIR compliant. So this data, this language is then used to store in a comprehensive health record. And this is a single source of truth. What this does is this stores every single interaction in the secure store, and it allows the sharing of the data from one tool to another. So for example, information collected in Health Check during the assessment can help pre-populate some of the questions in the symptom checker. Next up, we have perception. Now, the clinically minded will know that this doesn't exactly match how the brain works. It's a useful way of understanding all the different tools. But for perception, this is all about understanding the content, context, and intent of a person's interaction. So through the chatbot, they can enter their symptoms, and we can determine what they mean by this and gain this medical data. We're also exploring the use of voice and vision to understand the spoken word and also what people see, the appearance of a person. But increasingly important is remote monitoring. And as telemedicine becomes embedded in normal practice after COVID, remote monitoring starts to become far more important. This is about remote tracking of symptoms, remote tracking of body measurements, compliance with interventions, all of which not only helps people self-care, but allows more continuous care from clinicians remotely. Next up, we have prediction, and we have Health Check. Health Check is a chatbot or a chat interface type product where a person goes through some structured questionnaires to understand more about the risk factors that contribute towards their risk of up to 37 different diseases, 22 available to the public right now, but also insights into their activity and mood and help them start making some plans to change some of those risks, to explore a little bit more about how those changes might affect their risk. I mentioned condition management earlier on. We've got guidance on managing chronic conditions such as diabetes, and we work on conditions like depression, asthma, and other wider chronic illnesses that affect the world today. And then finally, for prediction, there's risk stratification. This is using the data that we collect for patients to help not only get them to understand what their risks might be, but to help stratify the populations and identify those people that might require specific interventions to help improve their outcomes. And then finally, we have the probabilistic graphical model. And the probabilistic graphical model is what we call symptom checker or triage. And this extracts data or takes data from the users through the chat interface and then gets some information on symptoms, on risk factors, and then puts this through a probabilistic model to give them information on what the cause might be. Gives them some information. So that's the probabilistic side of things. But we combine this with a deterministic model as well. And this deterministic model is called Checkbase. And Checkbase is created by clinicians, and it's a sort of decision tree system that helps support collecting of information and then give triage outcomes to patients as well. Now, we combine these two tools to provide the symptom checker to help with reasoning and decision making. Apologies for this, with the decision making. And the reason that we use this, because there's a lot of different AI tools available out there, is that it's important when you're using digital health technologies to help provide information on an automated basis to patients, that this information is interpretable. You're able to understand why a person has been given that information. It's not has to make sure that this is not a black box. So with this model, you're able to actually show how you came up with the decisions and provide that information further on. So we have all these different tools, all these different components coming together. And then this AI brain is then, all this information is then brought together into something called the clinical portal. And the clinical portal is what clinicians use in Babylon to speak to their patients. Here's an example of it just here on the right, and you can see a patient in the center with a video consultation. On the right-hand side of that screen, you can see the notes that they've been taken, and then a summary of some of the information that's taken from these other tools that they've interacted with present in the outside. So what is this all doing? What does this all help with? Let me see. So I've taken you through how at Babylon we believe that we can put the accessible and affordable healthcare in the hands of every person on earth. I was asked to talk about how we bring humanity back into medicine with the help of digital health technology. So using our tools, we believe that we're able to achieve our mission statement and provide personal knowledge, not only personal knowledge about the users by acting as a continuous resource that they can use to help care for themselves and predict and understand more about their health going forward. And that information is then made available to the clinicians that are then able to speak to them as well, if and when they need this. It's a continuous resource. People use their smartphones and internet access all the time, and this is a great way for them to actually control their healthcare from home. But the really important thing about bringing humanity back into medicine, as far as I can see it, particularly with technology, and I found in my own practice, is that it's about freeing up time to care. In when I was working prior to joining Babylon, what I found was that my work was increasingly becoming like a conveyor belt. I was bringing people in. I was seeing them very quickly. I was thinking about how I might be able to move them on and sort out their problems in as quick a way as possible. There was no time for me to focus beyond the immediate presentation. And even if they did come in and try and help me with this, I'd actually be struggling a great deal to try and synthesize that in a way that I can provide to them. By using technologies such as I've shown you, to be able to allow a patient to consider their own care and self-care and then summarize that information in a digestible form, it frees up time for me to not only identify those things that are important to me as a clinician to care for the patient, but also take away some of those tasks that don't really require a doctor's input or a nurse's input. You know, allow people to order their medications remotely, allow people to get the certificates they need remotely. I'll answer questions through messaging as opposed to bringing every single patient in to see you face to face, even if that is possible. And if you can do that, that then frees up that time to care. That then frees up the ability for me to be human with my patients and connect in the way that we really need to. And that is me for now. I think I've gone through quite quickly. I had to juggle a few little technical snafus in the middle, but we've made it, which is the most important thing.
Keith, we made it all the way, and you may have been aware of those in the middle. We were just hanging on your every word there. It was absolutely fascinating. And the thing I really was intrigued by was from our first talk this morning with Austin and Andrew, and then through to yourself, Keith, one of those recurring themes we're seeing already is about the ownership of data in the hands of patients when it comes to their own care, and you having that ownership and you deciding who gets that and what happens with it, but then to explore the possibilities of what that could lead to is absolutely incredible. So Keith, thank you so much. That was a really valuable insight into how we can keep that human input when it comes to the use of digital health as well. And we're moving on to something quite different this morning. Joining us now, and hopefully you are there, Sarah Ticho, the founder of Hatsumi, now a research and design studio that works at the intersection of arts, health and immersive technology. Now there's a Venn diagram and a half. Sarah, a very good morning to you. Can you hear me okay?
Yes, loud and clear.
It's lovely to see you and hear you. The floor is yours. We look forward to what you have to tell us this morning. Welcome to Jersey Tech Week.
Oh, well, yeah, thank you so much for having me, everyone. And brilliant talk from Keith. We've met each other quite a few times before, because I guess the VR healthcare world is quite small. I think it's always really exciting seeing what he's up to with Babylon Health. So thank you again to Austin and the team for having me as well. I think the work that's going on in Jersey is absolutely extraordinary and world leading, and so it's really exciting to see all the developments that have been happening. And so I guess as a bit of introduction, my name is Sarah Ticho. I guess I sit on almost the other side of the spectrum, that I became interested in the applications of virtual reality in healthcare from being a patient and really kind of struggling with ways to communicate my condition and what I was dealing with at the time to a doctor. And so I guess, and then ended up sort of entering the world of the arts and actually being really interested in the application of the arts as a tool to really ignite conversations about difficult and challenging experiences and helping us find ways to understand ourselves. So I have a background in anthropology, specifically biological anthropology, and it was after actually finishing university nearly 10 years ago now that I actually lost my father. And I think grief does interesting and difficult things to everybody, and it really sort of changes the course of your life and I guess how you think about the things that are important to you. And it was around that time that I started volunteering at this art gallery down here in Brighton in the UK called Fabrica. And this exhibition, The Blue Route by Karina Kaikonen, I think was a really big experience for me. And being able to stand in this gallery and speak to people about what this installation meant to them, and seeing people get inside it and play with all these shirts and exploring this theme of grief and actually, you know, all the people that inhabited these shirts that were no longer with us anymore. And And it really got me thinking about, the different applications of arts and how you can make that potentially more accessible to people to start these deep conversations. So skip forward a few years later, and this was the point that I actually became quite unwell. And so I think it was in 2014, I ended up having what was later described as a psychotic episode. And so it was sort of going to a doctor's office and sitting there trying to, what I felt like articulately describing my own experience. I felt like I wasn't being heard at all. And within that, in that initial consultation, I was offered very strong antipsychotics. And I remember thinking, like, I don't know if I'm being listened to here. I don't think this is what I need. And I'm trying to find the words to explain that. And yeah, this isn't necessarily what I want. But I think in those moments, it's very difficult to describe how you're feeling and what those needs are. On average, you have about 11 seconds to convey your condition to a doctor before you're often quite likely to be interrupted. But actually, they want to find out more and ask those questions. But it's the feeling of almost having to perform what is going on for you and all of the things that led up to this meeting, both from a medical perspective, but also from an emotional and psychological perspective as well. And so I became really interested in film and storytelling as a way to think about how we could start to visualize and understand these experiences. And it was then that I really came across virtual reality. So at this point, not a healthcare tool at all, because I had no understanding that there were all these incredible applications across, pain management and mental health and beyond. So yeah, it really started this question for me of how can technology be used as a tool to understand this experience. And this is a project that I remember being really impressed by a few years back called A Machine to Be Another, where it's this experiment done by this group in Barcelona where one person has a camera on their head, and that image of their perception out to the world is essentially being live streamed into somebody else's headset, and you could actually start to feel like you're embodied in this other person. And they did research on how this could be applied, or what happens if it's a man and a woman trying this, or people from different cultural backgrounds, and found some really interesting discoveries in how it could reduce things like cognitive bias or improve empathy as well. And so this really started this journey for me of like, I want to make something and I don't know what it is, but I find it infinitely fascinating. So I ended up moving to Australia, and I started working with the Big Anxiety Festival, which was an arts and mental health festival run by the University of New South Wales in Sydney in collaboration with the Black Dog Institute. And it was there that I met this really fascinating researcher called Dr. Catherine Boydell, who introduced me to an existing arts and health research method known as body mapping or body map storytelling. And so this is a research method that has existed for some time. Traditionally, what you do is you trace around your body on this large piece of paper, and you go through a mindfulness experience, and you start to think about, what does my anxiety feel like for me? Where do I feel that in my body? Is it green or purple? Is it fizzy? What words do you use to associate with that? And you build it up into this artwork that essentially enables you to show rather than tell how you're feeling, and start to visualize things in a very different way. And instead of trying to find those words, then sort of look into that sensory experience and translate it. And I was really captivated by that as a concept. Next slide. And so over the last few years, then, I've been working with a team of technologists, artists and scientists to think about how this could be translated into a virtual reality experience. For those of you that haven't necessarily tried virtual reality before, I think that's one of the things that I find so interesting about it is once you put on that headset, you are somewhere else. You can create these, beautiful worlds that can really change how you think and feel in that moment. And I love the idea of having this moment where you could escape and use that place that someone's created for you as an opportunity to reflect on your own experience. And so with this, what we've been doing is working with patients with lived experience of chronic pain. Actually, at the moment, is a big area that we're exploring, and thinking about, could you draw this using three-dimensional animated drawing tools? Can you start to think about where you are feeling those feelings in your body? And draw it not just on this 2D piece of paper, but using colours, a variety of colours and textures, And it's been really interesting seeing how by putting it into this virtual reality environment, that really changes it, because as you can see in some of these images here, people are not just drawing, inside their body, they're drawing on the skin and outside their body as well. And I think by putting people in these environments and giving them a very different way of interacting and playing with this idea of how am I feeling, it really changes those conversations as well. So in the bottom left, that's actually an image of somebody drawing the feeling of telling their partner that they love them for the first time. And I think the most interesting thing is always these discussions afterwards. You go, hey, can you tell me more about like what this illustration is? And they were like, yeah, I got really shaky and nervous. I had like pins and needles in my hands, and that feeling like, when you just want to sort of engulf someone in affection. And I think having known this person already, I thought that was such I got it in a way that I hadn't before. And in the bottom right, that's actually a sound designer drawing the feeling of making music. And this idea that you're trying out something and putting it into the world, and then you're seeing that response coming back, and you're constantly trying to refine it. And so the applications are quite broad, but the key area that we're really starting with at the moment is chronic pain. And so a while ago, I actually went over to Guernsey, across the water, and did some work with the hospital there. And we actually started to test this out in the pain department. And this was a really exciting few days we spent with the Arts, Health and Culture Manager, Lottie Barnes, and some of the team over there. And we worked with a pain patient to get them to start to illustrate what their pain felt like. And again, this is one of the resulting images that he did with his consultant pain nurse. And it was through that discussion that he started to distinguish between the emotional and physical pain in his body, because naturally, like, both of those things exist at once. And started to draw this kind of movement in his head as well. And that started a conversation about the emotional effects, and actually led to a very different new care plan for him. And the consultant nurse was like, this is really interesting, because I feel like I could potentially take this to another pain consultant, and perhaps they might actually be able to tell what that is. So with the research we're now doing, we've recently been working on some of the AI applications of this, and starting to think about, well, what happens if you get 100 illustrations of people drawing their chronic pain, and how do these things perhaps vary based on age or gender or where in the world you live, or different belief systems, and actually looking at being able to analyse both quantitative and qualitative data together, as well as looking at how this can improve sort of individual consultations. And finally, thinking as well about the fact that people are creating art through this as well. How can this be used as a public engagement tool, and being able to exhibit anonymous illustrations about all sorts of different conditions, from pain to depression to falling in love and making music, and thinking about how we can start to have these conversations about these invisible experiences that we do all have day to day. And sort of being able to create new forms of empathy around that. And so it's been really interesting working with, a very multidisciplinary team. And I think, one of the real strengths of this, and like lots of the work that is coming out of the VR healthcare world, is that we have to work with games designers and artists. And we've been working with a synesthete who has lexical gustatory synesthesia, so he tastes colour, and being able to think about, well, how do we translate pain into colour or sounds as well. I find extremely fascinating. And so again, it's like this idea of how we can, a bit of a formatting error, but please ignore that, but this idea of how can we bring together quantitative data, which ultimately healthcare professionals need to be able to understand and analyse what's going on for somebody in this very short period of time, but also how can we bring in this more qualitative way of being able to understand people's unique experience. And instead of just getting people to, for example, fill in a standardised pain survey, or get out all the pens and crayons and paints, like, is there this sort of, place in the middle where we can use virtual reality for body mapping, as well as more web-based applications as well. I'm also going to talk very, very briefly about another project that I'm involved in called Deep, just because I love it so much. And I think I've learnt so much through being the producer on this project. And it's a really interesting example of using biofeedback and actually bringing the body into VR to help people understand what's going on for them and sort of learn skills in how to self-regulate their emotions. So this is a breath-controlled VR experience that's been designed by a collaboration of artists and scientists, Owen Harris and Nikki Smith, other directors, and they've been working for the last 5 years with Radboud University to make this game where you put on a virtual reality headset and you have a breath belt that you put around your diaphragm. And through slow, deep breathing, you move for this beautiful, expansive underwater universe. And initially it was shown at art festivals and film festivals, and it was actually a curator that went, this is really interesting, like we could apply science to this, and we could, look at how this is genuinely affecting people and supporting their ability to self-regulate. And so we've been putting it through a series of different clinical trials where we've been looking at, can this actually help people manage their own anxiety? And we've been bringing it to schools, looking at how it can help children with complex needs and disruptive classroom behaviour calm down and re-enter the classroom environment, but also looking as well at, long-term applications of it in anxiety management. Because I think what we don't want to do is start creating VR experiences where suddenly this is a new thing that we're going to rely on and that people need to use every day. But I think what's interesting about experiences like this is through seeing your breath visualized, like you can see in this image here, and having that sort of world responding back to you, you start to recall that as a real memory. So perhaps in moments later on when you're feeling stressed, then you can still imagine your breath moving through this space. And again, like teaching these skills in self-regulation that I think are quite difficult to do. So for those of you that are scientists, and we've been publishing quite a lot over the last few years, and here's some of the data that we started to gather. We've now also started looking at the applications of it in respiratory issues. So there's a really incredible hospital in Vienna that have been looking at how it can support people with COPD. And we're also starting a really exciting new project with the Brave Institute, which are a PTSD research centre in the US, and looking at how it can be applied to young people with PTSD as well. So I think I'm just going to wrap up by saying what I think really needs to come from this really interesting and exciting world of XR and healthcare, because ultimately there are people like me that I'm not a healthcare professional. I sort of stumbled into this and now work with people. But, there's lots of very interesting, exciting work that's happening both in businesses and companies. There are artists working in the space. There are obviously healthcare professionals and academics. But it's very fragmented. And there's this increasing amount of evidence that goes look, this works, and it's really exciting. But ultimately, there isn't really an underpinning strategy. There's no way to distribute this in a standardized way. There's not really a lot of regulation at the moment. And I think that it's such a unique and exciting area where it's games and storytelling and healthcare all coming together. But we need to find a way of having that common language, inviting a diversity of people to that conversation, making sure that there is representation, because I don't think there really is at the moment. And often then when you go to these conferences, then it seems to be a certain type of person that you see there. And we need to make sure that with healthcare that everyone is working together. And really, having opportunities like this to say, look, there's some really interesting stuff out there. And how can we support more people working in this space and making interesting, exciting, playful, impactful things. So I'll wrap up there, but thank you so much for having me. This has been a really nice opportunity to share some of the things that we've been up to. And please do reach out if you have any questions.
Sarah, thank you so much. I can just hear and feel your passion oozing through the screen there, and you really wanting to beat the drum for this intersection between health and arts and technology, and the idea of arts and health when it comes to things like anxiety and being able to visualize things that perhaps you're not always able to vocalize to your doctor or therapist is one thing. To take that into an even more immersive way way is something else altogether. Absolutely fascinating stuff. Sarah, thank you so much for that. I hope you're enjoying this so far this morning. I certainly am, learning loads along the way. And when we spoke to Austin at the start of the morning about his love of ones and zeros, actually realizing how rich this whole area of digital health is absolutely fascinating. Still to come later this morning, we'll be bringing together some of these themes with a panel discussion. First, though, it's time for another of our sessions. Now, if I turn behind me here, hopefully calling Juhi Tandon. There you are. Became the co-founder and clinical director of Cognitant a couple of years ago, a leading luminary in the digital health field. And just as earlier this week, Juhi, when we were talking about diversity and representation in fintech, I guess it would be good to talk about that this morning in the context of digital health. So good morning, welcome to Jersey Tech Week, and it's over to you.
Thanks so much. Can you hear me?
Fine.
Brilliant. So thank you for the introduction and for inviting me here today. So my background is I'm an NHS GP and I'm clinical director and co-founder of Cognitant Group. And I'm really excited to be here and hear all these interesting talks. Keith and I have talked before in Tallinn last year, so it's nice to see him again. And also Sarah, what a fantastic talk. So interesting to hear about things from the patient's perspective. I very much come from it from the doctor's perspective, so it's great to hear your side. I'm going to spend the next 10 minutes talking about the role of women in health tech, the importance of gender diversity within this industry, and really a little bit about my story on how I got here, changing the face of the stereotype. Before I start, I'd like everyone to, close your eyes and picture what a health tech founder might look like, and we'll come back to that. I'm just trying to operate my slides. It says it's reconnecting. Thank you. So this is the evolution of my identity. Two things that I always wanted growing up. One, to be a doctor. Two, to be a mother. So in 1999, I found myself at University College London on the conveyor belt of medicine. Lots of rote learning with little application for creativity, but a clear path with a rule book, and one that I most definitely was thrilled to be on. I was passionate about making a difference and glad to make my dream a reality. Fast forward 20 years and I'm a GP that's worked in both the public and the private sector. I've just had a message, turn my screen down slightly. Is that better? Okay, sorry about that. So where was I? Okay, sorry, I'm getting lots of messages, so I'm trying to read and present at the same time. So 20 years on, as I said, GP in both the public and private sector, but also now co-founder of Cognitant Group, a health tech company. So this wasn't part of my 5-year plan or even 10-year plan. How did I get off my conveyor belt and into this new world without a rule book, without footsteps in the sand to follow? Did I ever think that I wanted to be part of a health technology company? Not really. It never occurred to me that as a female GP, that specializes in fitting coils and, dermatology, that I could have anything to add in the health tech world. And here is why. I'm sorry, I'm having to go back to my slides and reconnect. So this is the face of the IT stereotype. I bet some of you may have had this image in your head when asked to think about what a health tech founder or a tech founder might look like. Here's our friend Mark Zuckerberg on the left, and this on the right looks like the HBO Silicon Valley character Richard Hendricks. Neither of these look like me. Furthermore, Mark is surrounded by men. I can't see a single woman in that picture. Am I an IT geek? No. Do I speak tech language or do I know how to code? Most definitely not. The wrongly portrayed tech stereotype, male, glasses, lacking social skills, has been firmly ingrained in us from school days. So it's no wonder that women steer clear. In fact, according to females working in actual Silicon Valley in California, when 3/4 of the workforce are male, they're actively discouraged from perusing jobs in technology because of the bro-grammar attitude and culture brought in from college campuses. In fact, I'm sorry, I'm having to switch on my phone each time and get reconnected to turn slides. So there we go. In fact, women in leadership roles are underrepresented in many industries, whether talking about aviation, agriculture, finance, sport. And despite the healthcare workforce being over 70% female, very few of these women actually sit in C-level suites. The health tech industry is no different. Only 9% of health startups are founded by women. And even this example on the board is showing only 23% of tech jobs are held by female employees at Apple. I'm sure you all know the reasons for this. Number one on the board has to be the lack of role models within the technology world. And this really boils down to the gender stereotyping that exists of boys being better at science and maths. But what this leads to is this chicken and egg cycle, as the talent pool of females in tech is low. So employers have fewer women to choose from when recruiting. I think it's really crucial to emphasize how important it is to have a balanced workforce when it comes to sharing ideas, creativity, leadership in new projects, particularly within health tech. When a company lacks demographic diversity, then profound errors of judgment can occur. And a really good example of this is when Apple released their health app in 2014. And you were able to track every health metric from your pulse, your blood pressure, your alcohol level, even your inhaler technique, but they neglected 50% of the population by failing to add a period tracker, something so simple that took them a year to fix. I think that if they had better gender balance on their team, then this probably wouldn't have been an issue. But anyway, I digress. I come back to my story and just waiting for my slide mover to connect. I really like this slide, and I like Albert Einstein's quote: "Logic will get you from A to B. Imagination will take you everywhere." How did I come off the logical conveyor belt of medicine? Well, I'm not a tech native, so my entry into the health tech space came from a chance meeting at a conference that I wouldn't normally have chosen to attend. I was introduced to the Wired Health Conference by my husband, Matt, who is in marketing, nothing to do with medicine, but has subscribes to the tech magazine. He could see me getting less satisfaction from general practice, and he encouraged me to use my imagination, step out the box, and said, an open mind can take you places. It's probably some of the best advice I've ever received. Well done, husband. I can honestly say that conference, the Wired Health Conference, completely blew my mind. Scientists, medics, entrepreneurs, and tech experts from all over the world converging to discuss cutting edge innovation within healthcare. I heard so many inspiring talks from, AI health companions to machine learning predicting prognosis and death from EMRs, wearable tech surpassing smartphones and the latest innovation, and the use of virtual reality to rehabilitate stroke patients. So this was a world away from my four walls of general practice, where I was getting significantly burnt out with back-to-back rapid consultations, little time to do the job that I wanted to do and the way that I wanted to do it. No time to educate my patients about their health, which would make a big difference to their outcome. It was at one of these Wired Health Tech conferences that I by chance met Dr. Tim Ringrose. He was CEO of Doctors.net UK and then M3 for several years. Tim was leaving M3 and he knew I was looking to use my experience in healthcare and in the NHS to dip my toe into something innovative. What that was, I didn't yet know. But then in April 2018, an opportunity presented itself whereby Tim, myself, and two other highly experienced healthcare industry experts with tech and commercial backgrounds founded Cognitant Group. Not only, and I'm proud to say that not only are the founding team diverse with a 50-50 split of men to women, but even though now we are 11 employees, 5 of us are female. So that's pretty good, I think. In true startup style, the 4 of us huddled for 5 days in a Google Venture style design sprint, mapping out the problem we were trying to solve, looking at solutions and coming up with testable hypotheses, and then producing a prototype. And the problem we were trying to solve was this: patient information. Its content, its delivery, it's archaic and needs innovation now. As a GP, I'm passionate about preventative medicine and informed decision making, but I find this incompatible with current consultation models due to short appointment times, misinformation online from Dr. Google, which we've already heard about, and poor health literacy. Patient information leaflets can only go so far. So our mission was to empower people to with clear, reliable health information. The purpose mainly was to improve health outcomes and informed choice. So we looked at how we could do this. And we worked on how can we bring health information to life? How can we make it an experience? We've already heard how powerful virtual reality is from a patient's perspective with Sarah's great talk. VR is being used in medical education and in therapeutics. It's a very powerful psychological medium that has the ability to implant information in our brains through experience and bypass normal learning pathways. VR is being used to treat the next generation of surgeons, how to operate, teach medical students anatomy, and from a therapeutics angle, it's being used to treat PTSD, phobias, distraction for pain distraction therapy, and it's also being used to rehabilitate stroke patients. But this technology is not currently being harnessed to educate patients about their health. And I think that it's important to say immersive content using animations, avatars, interactivity is far more engaging than a flat 2D text-based patient information leaflet. Immersive content can really help bring learning to life with better retention and better recall, enabling informed decision-making and actual behavior change. So whilst I think that immersive information is the future, with the cost of headsets coming down and its adoption rising each year, currently only 15% of the population own a headset. And of course, with COVID-19, it's meant that any headsets we placed in primary or secondary care was futile because A, we've gone to remote consulting, and B, patients are not going to want to share headsets. But one piece of technology that we all have, well, 88% of the population has, is a smartphone. And not only is this VR capable, but it also is able to play the same 2D content and still retain some level of immersive quality. So we adapted our model. Knowing that patients trust health information given by their doctor and that most have a smartphone, the Healthy Note app was born. Healthy Note is a digital information prescription that contains animations, avatar-led learning with built-in interactivity. This can be delivered directly into the hands of patients via their smartphone. And it's actually proved to be an incredible adjunct in the remote consultation world post-COVID, particularly with something like contraception counselling. So we produced a counselling tool which has been pushed out digitally, and we've had fantastic feedback from it. The digital transformation of the NHS post-COVID-19 has shone a magnifying glass over the problem, with virtual consultations being the new normal. We need to adapt to deliver health information in a virtual world to educate our patients that is, digitally, seamlessly, and in a format that is easy to understand. When we created Healthy Note, we never in a million years thought it would be part of something so much bigger and so necessary in the aftermath of a pandemic, where patients have felt neglected, unable to access their doctor or access essential health information. The era of patient leaflets is over. I'd like to close by saying that at the heart of any health information innovation is a healthy diversity of men and women, but also people from different professional backgrounds, each bringing together their unique skill set. I think the gender balance and professional diversity within Cognitant has been integral to the shaping of our company. It's helped us to look at the problem from multiple different viewpoints and create what we feel is the future of patient health information. My vision is a world in which my daughter is informed and empowered with trustworthy information to enable her to make the right decisions about her health. Thank you.
Juhi, thank you so much. Absolutely fascinating. And I took your advice. I have my smartphone with me now, so I'm ready to go with all the ideas you've spoken about there. How much are we learning today on our Digital Health Morning? And there's much more to come. Another fascinating talk in just a second. And then we're going to bring together some of the people you've met so far this morning to get their thoughts on the issue in a slightly broader way. First, though, the man of the moment, CEO of Digital Jersey, Jersey, and that is Tony Moretta is with us now. Tony, give or take a few minutes, and don't quibble over minutes with me. We're about the halfway point of Jersey Tech Week, a week where we've done it very differently. What's your take on how it's going so far?
I have to say, at the beginning, when the team talked to me about making this very different from the typical webinar we're used to seeing, I'm showing my age by saying it looks like blankety blank with the rows of people on screen. We've really made it different. And the fact that the whole team has been able to turn the Digital Jersey Hub into a studio. You've done an amazing job, obviously, Gary. I'm sure you loved every minute of it.
I have.
And what we've particularly done, I think I said to you at the beginning of the week, what I'd like to do with events here is not only bring some great speakers from around the world, and doing it virtually actually helps with that. And we've had some great speakers. We're going to have some more the rest of the week, but it gives us a chance to show off what we've been doing. And I particularly loved yesterday morning session where we showed the world how we've responded to COVID in terms of technology, not only in terms of how we've dealt with COVID itself, with the contact tracing and with the testing and everything else, but how we've helped people work from home, how we've helped people survive from home as well. And I'm really proud of what we've been able to show off in terms of Jersey's capabilities.
What I think is interesting this time around with Tech Week, whereas in the past we've tried to show the world to Jersey because the audience is here, we've turned that on its head. This has been a platform to show the world what this little rock can do. It constantly punches above its weight.
It does. It's an overused expression, but it's true. And friends of mine back in the UK, I never cease to amaze them. They always think, is there enough to do on a 45 square mile? Is enough happening? And they can't quite believe the things that regularly keep happening here. The people that are here, the ideas, the people that come here with their ideas. And actually, this is one of the things we've got to do in Jersey is not only actually help ourselves, not only transform our different industries, build a digital sector, but actually shout out to the world. We've been doing it for years with our agricultural products, with our International Finance Centre, and we're starting to do it with digital as well. I mean, wasn't it great? Only a couple of days ago, the Telegraph had an article talking about testing in the UK and airports, and it had in the headline, even Jersey's ahead of us. I'm not sure I like the even bit, but actually, isn't it great that we're starting to get that message out around the world? And having a virtual Tech Week helps with that. It's not just the people that are watching right now. It's the fact that we have that on record. People who are considering relocating to Jersey, moving here, they can look online. And I think that they're going to be amazed with what goes on here.
I hope so. That cut through is happening, and I hope we will continue to do it. Tony, for now, thank you. Before the week is out, can we catch up again?
Yeah, absolutely.
That's the right answer, because I need to speak to you before the week is out. Right, let's continue with our digital health morning now. Been learning absolutely loads during the course of the morning. Let's think about the island as a sandbox and where this could take us in this digital health sphere. You've seen him once already this week. Andy Delaney is here from TSG. Andy, good morning. It is all yours.
Thanks very much, Gary. Okay, welcome everybody. We've got an exciting session coming up. I'm joined by my colleague David from Concentric. What we're going to do is talk about Sandbox Jersey and the digital delivery and flexibility of that. So I'm going to hand over to David, and he's going to run through some of his perspective from being an off-island supplier, providing services into the island and utilising that Sandbox Jersey. Morning, David.
Good morning, and thanks, Andy. Thanks for the intro. It's great to join to discuss my perspective on Sandbox Jersey and the opportunities for everyone. So I'm Dafydd Loughran, a surgeon by training, and now Chief Exec of Concentric Health, a health tech startup based in Wales. So Concentric is a digital consent and shared decision-making application, and it's used across a number of NHS trusts and internationally. And our mission is to transform how decisions are made about our health, decisions informed by patient outcomes and shared by patient and clinician. So we're a small team focused on a complex but niche problem, finding a solution to that problem at a global scale. And for me, that's the perfect space for industry to support public healthcare systems. So at Concentric, we've been working with the team in Jersey since late 2019, with patients giving consent digitally since earlier this year at Jersey General. And so we can also compare that experience with deployments at some other much bigger, more complex organisations. So my reflection on that is that at Jersey, it's been much easier and faster to get started, get testing, understand what's working, supported by individuals such as Andy and Austin. Rather than dealing with complicated organization logistics, of approvals, onboarding, everything that comes with that. And it also means it's a good place to do to test ecosystem plays, where different products work together to create a solution that's it's greater than the sum of its parts. But these ecosystem plays usually bring significant delivery complexity too. And so if you even imagine taking on that complexity at a large, unwieldy organization, it's very, very hard. But these projects can certainly thrive in partnership with an effective, focused innovation team. And at Jersey, we're doing one of these projects to seamlessly link together, from both the patient and clinician's perspective, a preoperative assessment product with Concentric's consent application. And at Jersey, so very, very intentionally, will be the first time that we've tried to do it. This will mean that the whole pre-treatment pathway can be done remotely, which of course is of particular importance at this time, and uses clinician time appropriately, but really importantly gives patients easy access to their personalized information to support decisions and their recovery, all from the comfort of their own home. And one thing I wanted to highlight is that for me, the sandbox works for all. So it works for digital health companies to forge ahead with delivering best of breed applications. It gives clinicians and patients of Jersey access to the cutting edge of healthcare technologies, but it also creates business opportunities locally. So for example, each of the integrations needed by solutions such as us at Concentric are supported, often configured locally, delivered locally by Jersey-based companies such as TSG. So Andy, you can take on from here and add your reflections on Sandbox Jersey and the role TSG has to play.
David, that was brilliant. So we're here and we support our off-island suppliers with strategic support on island. So what I'd like to just pick up on is, so I'm going to talk more around the digital delivery aspect and the flexibility that surrounds that, and most notably its impact on time. So just a quick bit about me, just to provide some introduction. My name is Andy Delaney. I'm the Chief Exec of TSG, and I lead a team of technology innovators and specialists called the Time Saving Gurus. You can get us on all social media platforms. We're available on Twitter, LinkedIn, Facebook, via our website, and recently we've just launched a new podcast, the Time Saving Gurus Technology Unplugged, where you can get some great insights on time-saving tips. So why the time-saving gurus, you may ask, and actually where's that tied back to the subject for today? Well, as a business, typically we're measuring success for us around three key metrics. Those three key metrics are time identified, time recovered, and time reinvested. So let me just unpack those for a second, just to provide some context. So time identified is really looking at process to understand how long something takes, that elapsed period of time, and then actually looking at it in more detail to understand the work effort involved in delivering it. Once we've managed to do that and the analysis around it, we can look at that time recovery piece. So how can we reduce the amount of time that's used? How can we make the process more efficient and productive? And then also, reduce that work effort and elapsed time period. And then once we've undertaken that piece, we can look at how we reinvest that time. Now that's the critical piece to that model. We can take the time that we've recovered, and actually time in effect equals money. So if we can recover time and money, we can then present back to the business how they can use that money to invest back into their business in people, education, skills, or technology. And that's great, but what does that really mean? So it really means we focus on three key elements, and that's increased productivity, increased efficiency, and ultimately improve bottom line profitability. And this applies for all types of business, whether it's a startup, an SME, an enterprise, or a government. So what does that mean in the context of future of delivery, digital delivery, and the flexibility around it? Well, actually, what it means to Jersey is that Jersey can harness that time and use it to drive change and innovation. And that's where Sandbox Jersey comes in. So Jersey is a hotspot for innovation, and we've seen that during the last 6 months. The amount of innovation that's happened on this island to drive new solutions, digital solutions, has come about through that digital delivery mechanism. All ideas have to start somewhere, so why not in Jersey? There's a perception that sometimes we're a little island and how can we have good ideas? But actually some fantastic ideas have been born in the island that have gone and been exported off island. For us, we've done that with a medical billing platform where we've used that Sandbox Jersey principle of developing it locally, test bedding it locally, and then exporting that off island to great success in the UK through the NHS. The key piece around digital delivery is around that agility, being able to deliver solutions quickly. In an analog world, in legacy days, that agility was challenging, whereas with the empowerment of digital delivery, we can do that much quicker. And then finally, we've got collaboration. The collaboration with different stakeholders and businesses make this a much more palatable option. We can't do everything ourselves, so working together, we're able to deliver better solutions. Now, when we talk about new ideas, concepts, effectively, there's 5 key elements around that we look at. Those are the saving money, connected systems, having a purpose, streamlining, and removal. And that's effectively around removing unwanted tasks or tasks that are actually just there because that's how we used to do it. And no one's actually looked to see whether some of those tasks are still fit for purpose. Connected systems are key, being able to join system A to B, to C, to D, to E, to F, not just on a point-to-point, but multiple touch points, and actually being able to streamline those processes. And in the real world, what does that mean? So coming back to our concept of time, it means that we can get more time with our patients or our customers. We can improve the customer experience, and we can remove the distractions and allow people to focus on what they do best. And ultimately, if we can reduce that time and save money, then we can reinvest back into the business with the people and technology. And ultimately, that will benefit everybody by driving better morale, motivation, and well-being, by removing the anxiety, stress, depression, and mental health challenges that come about just from overworking. And fundamentally, what it means is we can get solutions delivered quicker. We can make it happen. So in closing, what is the future of digital delivery? Ultimately, it comes down to trust and working together. Let's get this slide up. There we go. And that is made up of a number of key elements. Partnerships is number one. Working with partners like Digital Jersey, like the Allan Lab, like our off-island partners, Concentric, NHS, EMIS, InterSystems, just some of who we work with. Strategic partners delivering services locally like G4S, and delivery partners. Integrated technology allows digital delivery to be completed in a much more efficient and productive way. And really what's important is key enablers and influencers, everybody working together with a like-minded attitude to get things done. Being agile and delivering solutions quickly. And most importantly for Jersey is sustainability, providing local skills, local capability, and being able to future-proof solutions so that off-island suppliers can work with on-island suppliers to deliver results. And finally, it's about industry working together. No barriers between public and private sector, but industry working together to deliver results. So thank you for your time. I'm now going to pass back to Gary, and bye for now.
Andy, thank you so much, and Dav as well. Who knew that working together would be what it's all about? It's actually really reassuring to hear, whatever the sphere, that is at the core of all of this, as part of our Digital Health Day here on Jersey Tech Week.
People, I think, confuse digital health as being the computer in the corner of the doctor's room. Actually, what digital health is about is bringing the right data to the right person at the right time.
We need to have the ability for that data to be shared across all of the providers of care, and we need to enable patients and citizens to have access and to use that.
Understanding the impact of the entire environment on somebody's healthcare would be a great thing for Jersey to do.
On our Digital Health Day, we started the morning looking at all things through the eyes of virtual reality. Well, we've moved from the virtual world to the real world during the course of the morning to learn so many things about this subject. Now, though, this is the beauty of Jersey Tech Week. We get to combine real and virtual with our panel here, who are all familiar faces right now, because we've heard you and you're utterly fascinating talks during the course of the morning, but now we can drill down into some of this detail. Even if you've already covered this off a little earlier, I'd like you each to introduce yourselves, just your name and the 5 to 10 second version of you and your company, the elevator pitch version. So we'll go left to right. Andy, we'll start with you.
Thanks, Gary. So Andy Delaney, Chief Executive of TSG, a local business providing technology-led services with a principle around saving time and working with businesses to become more efficient and productive.
And Sarah, the floor is yours for a proper introduction.
Hi, my name is Sarah Ticho. I work, I'm the director of Hatsumi, which means to see something for the first time, and we're developing an adaptation of an art health research method called body mapping into virtual reality to help people use 3D drawing to non-verbally communicate pain and emotional experience.
Sarah, thank you. Dav.
Hi, I'm Dafydd Loughran, CEO of Concentric Health, and we're transforming how we all make decisions about our care.
I feel like you've said that a few times over. That was a very polished moniker.
You're meant to remember it.
And Juhi, yourself.
Hi, I'm NHS GP, clinical director and co-founder of Cognitant Group. We're on a mission to innovate patient health information, make it engaging using animations and interactivity built in, enabling better retention and recall so that patients can make truly informed decisions about their health.
Thank you so much for that, panelists. My mind is full of questions and observations as a result of everything you've been sharing with us during the course of this morning. The thing I keep coming back to in my mind is that at the centre of whatever you're doing, whether your primary focus is about healthcare delivery or those on the receiving end, that actually this is ultimately about patient-centred care and about the patients being in control of that data, that data that is absolutely core to digital health. Let's just talk about that a little bit more. And Andy, you're doing a lot of work with primary care providers, rolling out your time-saving guru material. It's sticking in my mind as well. But you must be acutely aware of that issue, that problem, that reality.
Yeah, absolutely. For us, it's really been able to drive solutions that enable the GPs to spend more time with their patients, because ultimately that patient-to-patient interaction is vitally important. We were having a conversation yesterday around actually just that testing process at the airport. And I remember you saying just actually the most important part of that was not the technology component, was that actual people-to-people part. So for us, it's really focused in, whilst there's a data element to it, as a software provider, we stay away from that data element. We purely provide the software component, but actually it's the enabler to allow the GPs to actually spend more time with their patients.
And Juhi, as a practitioner in this field, how mindful are you about this, or are you trusting that this infrastructure is correct in the first place? Is this on your radar on a day-to-day basis?
You mean about patients' data?
Absolutely,
or about,
yeah.
I mean, I think patients are realizing that actually, if their data is well looked after, a lot can come from democratizing data and improving health outcomes. So I think there's a slow shift in their kind of acceptance of this, and I think that's going to be important moving forwards.
And Dav, from your perspective, actually, this is ultimately turning it on its head, because you are very much focused on the patient owning that information and being the one with the agency when it comes to decision making.
Yeah, absolutely. And I think we see lots of side impacts of what we do. So one of the things that we see is that lots of that kind of decision making, whereas in an analog world, all of that decision making happens in that kind of often quite rushed 5-10 minute consultation, actually making it really easy for patients to have personalized and accessible information at home that they can engage with whenever. And Juhi's talked again about making that really immersive and not just a flat bit of information that actually it's really easy for them to engage with, in the 99.99% of their time that they're not in that, consultation with a patient, with a clinician. And actually that really increases the quality of that decision making. The cardiology team at Jersey will reflect on some scenarios where, if patients hadn't have had that information, at home that they could have, gone through, later that evening, the next week, etc., they might have made different and decisions that weren't as well suited to that individual. So it's still using clinicians to support that decision making, but actually saying, let's empower patients to make the right decisions for them, make decisions around what matters to that individual, rather than the kind of paternalistic healthcare that we're used to, and that's kind of how it's been for centuries, as it were.
Sarah, from your perspective, I get the impression you're actually approaching this from quite a fresh perspective on this panel, because lots of this is digital, is data, is black and white, is ones and zeros. To inject and overlay the arts into this in a digital way feels to me quite new. It might not be new to you, but it feels new to me.
Yeah, well, I guess that, arts and health has existed for a long time, but it has been a very sort of a smaller industry that perhaps has not necessarily had the recognition that it always has. I think that there is increasingly more of an adoption of how the arts can be used in health and well-being. We're seeing a real rise in things like social prescribing. So, for example, when someone goes to a doctor and perhaps they have anxiety or depression or chronic pain, like that is not just a medical condition. That is, what is happening in your life, what's happening with your relationships and your financial situation, how's work, are you exercising? And a doctor can't fix that in 10 to 15 minutes. Like it's a sort of bigger issue that really needs to be explored. And so we're seeing a rise in this new approach where you can get sent on to someone called a link worker that can have a much broader conversation about what's going on in your life and start to prescribe arts and social based experiences. And perhaps feeling part of a community is important, or, you used to love to sing. Did you know that there was a choir around the corner? And I think there's a lot of evidence now coming out about what a huge impact that has on people's lives. But I think what the next step is, whilst there is nothing that can replace being able to see someone face to face, like this year has really, highlighted that digital technology is really important, and how can we use play and games to be able to connect people remotely, but also this idea that perhaps you can measure and understand people's state or how it can improve over time. So if you are playing these games regularly that can be helpful in learning self-regulation or being able to express how you feel, then that means you can go to a doctor and say, for example, what we're doing with Hatsumi, then I've been illustrating my pain every day for a month now, and whilst right now I perhaps feel slightly better than usual, I've been painting in VR, and here are my paintings, and here is actually how I've been also rating it on a scale of 1 to 10. So now you know how this is changing over time, and it can have a very different discussion to or you can have a very different discussion to what may have happened otherwise.
Sarah, just to briefly follow up on that, from the perspective of our other three practitioners here on this panel, what you're talking about in some ways is more abstract than the blacks and whites of this industry. Is there data you are able to extract, for example, from the immersive art that a patient is creating that can then be useful at a more strategic level?
Absolutely. I think, so some of the research that we've been doing already is looking at if you can have a patient fill in a more standardized quantitative survey. So, for example, with understanding someone's level of pain, use something called the McGill Pain Questionnaire, which has been pretty much unchanged since the 70s. So if we get someone to fill in that and then get people to create illustrations, what we're doing is we're training the algorithm at the moment and starting to see early signs in if people are illustrating their pain in certain ways, can we start to potentially predict what the condition a patient might have before they go into a consultation room, and how can we understand not just like the condition they have, but perhaps these other factors that may be affecting them as well from an emotional perspective. So I think it's very early on in our development, but I think this idea of being able to get combined quantitative and qualitative data to give a richer understanding, and through digitizing that, we can take that one step further. But there are so many considerations along the way, from protecting patient data to biases in AI algorithms as well, and making sure that we have representation of people from various backgrounds when we're building and testing it as well.
Absolutely, indeed. Bias in algorithms is something we covered on a fascinating AI panel session yesterday, if people want to catch up on that later this week. I just wonder, all four of you, we've spoken at various points this week about, it sounds odd to say the upsides of a pandemic, but the ability of what we've all learned over the past 6 to 9 months to actually fast forward some of this technology, and for the end user to accept it, to feel actually this is where we're at now, that it's normal, that it's safe, that it is beneficial. Juhi, have you noticed that? Have you experienced that in your own sphere?
Absolutely. I think actually patients have really, generally speaking, embraced the digital transformation. So I know that when I've consulted with patients, either on video chat, they've just been absolutely, full of praise for the system, sort of saying, oh, wow, I had a skin lesion. I didn't really need to come in. You've got pictures and a video. They send pictures beforehand, and then I consult them on the video and have a look at where the lesion is. And actually, you can make a diagnosis, or you can realize I can't make a diagnosis. I need to refer this patient based on the picture, based on the video that I'm seeing. And it's seamless. They haven't had to leave their house. They haven't had to come in. It saved me and them time, and it's got that outcome that they needed. So in the majority of cases, patients have been very happy. Of course, there are going to be patients that do need face-to-face, and where that's why we do the triage. And when we realize actually I need to lay hands on you and I need to examine you in face-to-face, you can bring them in. But you've got more time to do that because you've managed to do the majority of your consulting on video. And I think just something else I'd like to say, something Daph picked up on having patients access information in their own time, whenever, as many times as they want, share with family and friends. This is the very basis of informed decision making. Sarah alluded to, and very rightly, when you see a doctor, you're interrupted, I think she said at 11 seconds. Well, that's exactly the problem we have in our consultation model. I don't even have 15 minutes. That was generous. I have 10. And we are in a world where patients have multiple comorbidities, multiple polypharmacy, and they don't present with one problem. Okay, and it's unfair to expect them to just, list one problem. They're not, a machine. You have to treat them holistically. But the consultation model doesn't allow for that, and there's no time to educate them. And actually, how are we, expecting patients to make informed decisions about their care without supplying them with the time and the knowledge and the motivation to make that change and to make the right decision? So anyway, I just wanted to pick up on both those points you made, because it was just so spot on with how I feel about the healthcare ecosystem.
It's a really interesting observation, and something I've heard anecdotally from GPs in Jersey as well over the past few months. That sort of sheep dip of 10-minute slots to see their patients, and it's often halfway through the door on the way out that the patient really tells you the story behind the story behind the story as the layers of the onion are peeled away. Andy, from your perspective, as you are overlaying technology to help doctors triage, to help them manage their time more effectively, what feedback are you getting from the real world use of that application?
So I think there's a couple of things there. I think just picking up on something earlier on, just to follow on from the question around the data side. So on the data side in health is extremely complex. Management of clinical data and the governance that sits behind that is paramount to keep that whole industry working correctly. You know, the regulations and the legal frameworks that come in to make sure that that data is correct, because clearly it's you know, has massive consequences. And so technology solutions are great, but the confidence needs to be there that that data integrity is sound. And sometimes it's very easy to forget that actually behind the scenes of a piece of technology sits this complex machine. And so, you know, technology solutions can come about quite easy. That's actually the relatively easier part. What we found is that whilst there's innovation around new solutions, the challenge is actually keeping the legal and regulatory frameworks to catch up, to enable these technologies to actually deliver the benefits and solutions that they can.
And are you seeing the willingness from regulators to speedily and we'll use the agile word, be agile in updating those frameworks to keep up with technology? Because it is going to be that way round, isn't it? If technology is doing the right thing, it will be faster than regulation. It ought to be. It needs to be on the bleeding edge.
It is, and obviously, you know, in our real lives, you know, technology has moved on massively, and in unregulated environments, you know, we're so used to having our mobile device that we can now do our internet banking on, or we can do our bookings on. So actually, why can't we have an app on there that has our clinical record or our medical record? And those technologies are existing. And yes, there is a willingness now behind the scenes with regards to that legal and regulatory framework, and governments and organizations that are actually now starting to be very acutely aware that they need to, you know, deliver quickly. And that comes back to that digital delivery piece, because now that those components and technological frameworks are in place within those establishments, they can now start delivering quicker.
I'm going to share a dream I have in my head, and you can all shoot me down for saying this is nonsense. And Daf, I'll come to you first on this one. In recent months, I've had some healthcare in Jersey, and I've also had some healthcare through the NHS in Southampton. And because they're operating in different worlds, when I have a blood test in Jersey that is needed to be seen by an oncologist in Southampton, as much as there is a system in place, I've actually, as the patient, found the faster system, which is that I walk into oncology in Jersey, I pick up a paper printout of my blood test results, I photograph it on my iPhone, and I then email it to my oncologist, which is obviously bomb pot crazy, but it is just how it is. I have a vision of this world, whereas with my passport for traveling across borders, I have a passport that I choose who I share it with that just has everything in one place. Dav, can we get there?
Yeah, absolutely. I mean, it makes sense, doesn't it? It's something that makes so much sense. You know, it's a fact that we haven't had those systems historically. Andy will kind of back me up on this to say there is no reason that we shouldn't have that in the future. And you know, indeed, there are, you know, companies like Patient Knows Best and others who kind of create patient portals to say, well, you know, there are challenges around sharing data between organizations. Let's work on those challenges. But in parallel, let's say, well, actually, you know, you're a patient, it's your data, you have it, you know, you can share it with who you want to share it with. But also, it means that, you know, you as a patient are spending a lot of time thinking about your health, whereas your clinician is spending a small amount of time thinking about your individual health, because they're looking after lots of people. So we see, you know, patients coming across errors in their medical record that they can then, you know, rectify and reduce clinical, you know, clinical safety risks and all that kind of stuff. So there's lots and lots of reasons for the patient to own that record and be able to kind of see that and have visibility of it. So for me, it's doing both in parallel. And there is certainly a lot of work in terms of interoperability and getting towards that point where organizations can share freely. But I think we should look at it in two prongs to say, well, patients will have access to their data and there's benefits to that. And organizations should also be able to share data between organizations, within certain sensible boundaries, and there's benefits to that. So it's not a one or the other. It's let's have both, and there's benefits to both.
Sarah, I can
yes,
see
we should actually do it.
Sarah, I can see you nodding furiously to what we were just hearing.
Yeah, absolutely. Well, I think, I do hope that we do get to that point, but change is hard, even on an individual level. People get frustrated when they have an update on their phone every once in a while, let alone completely revolutionising an international healthcare system. Takes a lot of time and effort. And I think, it is like we've been saying today about working together, starting small and having, these pilots of how can things work differently and what does that change look like. But I think when we're trying to protect health, it means that obviously we do need to regulate it. We do need to think about how we can do this in a safe way, but often that means that things can happen at a very slow pace. I remember one of my first jobs, in fact, my only official job in healthcare was actually in referral management back in 2013. And that was largely reliant on fax. And I was just standing there faxing things every day and going, why is this happening? And they were like, the NHS is big and complicated, and the kind of people that are working in administration are very anti-change. And so even this idea of creating this new referral management system that still used fax actually seemed very, very revolutionary. And we created this, there was someone on our team that created this API that meant that we could do email to fax. And again, everyone was like, this is absolutely huge. And I was like, oh God, what is the future of healthcare going to look like, especially when we're thinking about things like virtual reality and working with, increasingly tech companies that perhaps don't necessarily have a fantastic record of protecting data. Because, in the world that I live in as well, then with VR, the main headset that's being used is the Oculus Quest, which Austin was using earlier, and that's owned by Facebook. And are Facebook now going to start becoming a medical device or developing a medical device? And so I think there's lots of untangling to be done.
Oh my word. I was going to throw what I thought was a really simple question at all four of you, and Sarah, you've just undermined everything I was about to say, because I was going to say, surely this is straightforward. Surely we just bang a couple of heads together and this is sorted. Let's work along the panel on my stupid question. Andy, where's the block in this pipe? Where's the biggest blockage? If you could get your digital plunger out now, where would you shove it?
Well, dare I say it's time. We've alluded to it, all of us on the panel, is that, there are only so many hours in the day and everybody is very busy. So that's where enablers come in to help, reduce that time and make systems more efficient. And quite right, as we've said, that just sometimes takes time. It's the nature of being able to deliver systems based on the legacy systems that we've got in place are very difficult. Startups can be a lot more nimble and agile, sure, but actually established organizations trying to undo what they've done and then re-engineer it is just a mammoth, complex undertaking. And we work closely on Ireland with government over the last few years and have delivered some fantastic results, and government have done an amazing job in delivering some key projects that are real enablers now to be able to deliver much more agile and effective solutions. So, the next 18 months, 24 months are going to be real drivers around new solutions and being able to provide some of that more modern type technology that actually, customers and patients and users really would expect that frontline capability to have.
Juhi, what about yourself then? I was talking about where that plunger would go. I think I'm taking this analogy too far. If you could unblock one thing just to get the system moving even a shade more effectively, where would you be looking?
Oh God, that's the question. I mean, you have to change the mindset of the NHS, where I work in the NHS, and very archaic minds that are sort of stuck in a rut and don't want change. I mean, even up until just before COVID, I was getting, at the GP surgery where I used to work, we cover a residential home, and they were faxing lists of patients that were supposed to be seen the next day on a ward round, and their writing was impossible. So you couldn't understand, and they had, the dates of birth were all wrong. So I was accessing incorrect patient notes and just wasting my time calling the residential home before I left to do the ward round, saying, can you clarify all 20 addresses and dates of birth, please, because I can't read it on the fax. And that's only one problem. The second problem is GDPR and things. Where is that? Who is looking at that fax? Did it go to the wrong number? That's patient sensitive information, that's on there. Name, date of birth, what home they're in, what presenting complaint they have. I mean, there's so much wrong with that. And I kept, fighting back saying, why can't they just email it to us? Anyway, that's just one aspect. The plunger, I don't know. I mean, it's changing. I used to be a tradition, as per my talk, I never thought I would end up in this world. I've always been very logical, always been, okay, medicine's the path and this is what we know. And we're not taught in medicine really to think outside the box. It's very, very rote learning. It's not very creative. And you really have to push the boundaries yourself to come out and think about how can we do things differently. I mean, I'm traditionally very left brain, but you need to be a bit right brain to try and bring these worlds together and change attitudes. Trying to get anything done in the NHS is very hard work. There's a lot of red tape and bureaucracy and lots of hoops to jump through. So I think COVID may have helped to unlock some of that. I mean, we've had what would take 2 to 4 years of transformation in like 2 weeks back in March. So that was good. That was a silver lining, if I'm allowed to say that, even though COVID's horrible. It has propelled us into this new world. And I'm hoping that will be the beginning of this plunger where, okay, we can see what we can do now. Let's make this a reality and work hard on it together.
Right. I'm going to trademark digital plunger. Daph, just a very brief thought, because we're nearly at wrap up time. On the blockage, what's number one on your list? Where do you start?
Yeah, so I'd build on what Juhi just said in terms of COVID being that plunger and building on the plunger that's already in place rather than finding a new one. And I think my reflection on that is that if COVID was just one wave and people went back to their normal practices at 3 months or 6 months, then actually we might have lost some of those gains that happened very quickly in March and things that have been built on since then. But the reality is that, even if it's just until March 2021, people have been doing their new way of working in the world for a year. And actually, it's pretty hard for people to remember what they were doing in March 2020 by the time March 2021 comes. So I think these changes are here for the long term. And let's build on, those opportunities that we've seen by virtue of a pandemic.
Listen, I'm going to give you each, and please, stick to this. I'm giving you each 10 seconds, left to right. We're going to go to wrap this up. Andy, 10 seconds on your optimism for 2021 in digital health.
Very optimistic. And, I just want to kind of thank a couple of people, because it's going to be down to them that's going to make that optimism come true. And that's going to be Andy Mitchell, Austin Gibbs, and the technology department within government and Digital Jersey, because together, working collaboratively, they really are the drivers that are going to make 2021 for us in Jersey in the health ecosystem deliver the results we want to.
I'll make that 24 seconds, but I will forgive you.
Okay.
Sarah, your 10-second final thought on this before we disappear.
I think that I'm very excited about how technology can perhaps increase access and make healthcare more democratic. So I'm very much looking forward to the idea of inviting more people to the conversation and not just having this hierarchical structure, but bringing conversations together between patients, artists, doctors, and researchers.
I like that sentiment a lot. Daph?
Yeah, really excited for digital health in 2021 and excited for that in Jersey. So let's make Sandbox Jersey and turn that from sand into gold.
Oh, I like it a lot. And Juhi, final thought to you. Make it a goodie, no pressure.
Oh, no pressure. Okay. Very optimistic. I think the collaboration between patients, clinicians, technologists, scientists, if we can come together and build on what we've already done this year, I mean, you know, we can reach the moon.
We can reach the moon. There we are. Operation Moonshot is alive and well. The four of you, thank you so much. It has been a privilege, it has been a pleasure, and it has been an absolute education for me as well. Really appreciated. And I hope you've enjoyed this morning as well, as we've been focusing on digital health in Jersey and beyond these shores, of course. Now, we have another session starting at 3 o'clock this afternoon. Let's take a little look at what's in store this afternoon as we focus on the island as a test bed. Well, the one and only Mr. Digital Transformation himself, Joe Dignam, will be opening our day. We'll also be talking about creating a single view of a citizen. What precisely does that mean? We will find out. We'll also look at monetizing infrastructure data. After all, there are businesses to run, and we'll focus on driving economic growth, and we'll explore some of those thoughts with another panel session at the end of the day. So all of that is to come at 3 o'clock this afternoon. I hope you'll join me for that. In the meantime, from me and all the Jersey Tech Week team, thank you for watching. See you soon.